When you first hear the diagnosis of metastatic lung cancer, this is probably the first time you're really faced with your own mortality and the chance of dying. The other hurdle that you face when you receive that diagnosis is identification of a healthcare provider, of a doctor that you trust and who will guide your care. For advanced lung cancer patients, especially the medical oncologist is likely to be your main doctor, and identifying someone who can captain that ship and make the right decisions as to which way to turn along the way is a major hurdle for cancer patients.
The best thing that a patient can do is to be seen by people who are trained have some specific training in thoracic and oncology, because I think the field has changed again so much in the last 5 years, even in the last 2 years.
Some of the nuances about different kinds of therapies or trials can be more, the specialist, the thoracic oncologist, will be more on top of that.
Lung cancer is extremely common, so most oncologists do see a lot of lung cancer patients. But again, the average oncologist has to take care of everything, so it's hard to stay on top.
But usually what I will tell a friend if they call me up, you know, Daddy has cancer, they will say, I really like this clinic down the street. It's, you know, they have a very nice lobby, you know, it's comfortable, the people smile at you. And I say, it's fine, get an opinion there, but at least get one opinion at that dirty old crowded academic medical center, you know, in the city. Because you don't have to get your treatment there, but if they can find something sometimes that can make a gigantic difference.
There have been many times when the patient has turned to me and said, Doctor, what should I do? Some physicians, I think, shirk that responsibility in the modern era. I tell patients what I think I would do if that individual were a family member. And truly, that's the only way I can put that in context. I'm thinking if I'm speaking to my wife or my brother or parent, what would I advise them?
I'm a guide. I can't be in the situation for the patient. I can't do it for them. I can help them to the next steps. And so that's what I try and do with my patients, and hopefully the rapport is good so that they even would be comfortable to say, do you know everything that's going on with my tumor, or should I be looking other places? And that I can say, yes, this is the time to look somewhere else because we don't have what you need right now. So there should be open communication, and I think often patients don't necessarily take that to heart because it's such a scary time and they want to put all their trust into one person.
If we advise people to treat, we also need to be be able to provide information about when not to treat and when not to do certain kinds of things. And so that is the essence, I guess, of being a physician, in my opinion.